All right, everybody, welcome back for another deep dive. Today we are talking about something that is pretty important for, well, pretty much everyone.
It's true.
And that's the connection between type 2 diabetes and high blood pressure.
Mm-hmm.
Now, even if you are only personally dealing with one of those things, or maybe even neither, this is still super important to understand.
Yeah.
Because what happens in one area of the body can sometimes, well, I don't want to say predict, but kind of give us a clue about what might be happening elsewhere, right?
Exactly.
And the research backs this up, too. Like, we were looking at stuff from the TheEMTSpot, and they had this really startling statistic.
Yeah.
Having both conditions, type 2 diabetes and high blood pressure, that increases your risk of heart attack, stroke, are you ready for this death, by 4 times.
Wow.
4.
That's huge.
It's not just like a small increase.
Yeah.
So clearly, these two conditions, they're related in a way that we need to unpack. And luckily, we have expert speaker here to help us unpack it all.
Happy to be here.
So I think a good starting point for anyone who maybe needs a little refresher is, what exactly are we talking about when we say type 2 diabetes? It all comes down to how our bodies process sugar, right?
Yeah. So you've got glucose, right? That's the sugar. It's the fuel that our cells need to work properly.
Okay.
And then you've got insulin, which is like the key.
Okay.
That lets the glucose into the cells.
Got it.
But with type 2 diabetes, the cells, they kind of get resistant to insulin.
Oh, interesting.
Like imagine the cell there's like, not today, insulin.
He's like, I'm not letting you in.
Yeah.
So the key's there, but the lock has changed.
Exactly. It's called insulin resistance.
Okay.
And because that glucose can't get in, what happens? It just hangs out in the bloodstream.
Uh-oh. Traffic jam.
Exactly, a sugar traffic jam. And not just on any road. This is like your blood vessels. That's a big
Off
thing.
the super highway of your body.
Right. And all that extra glucose, over time, it starts to cause damage. The blood vessels, they stiffen up. They can't relax and contract as well. And that's bad news for blood flow.
So it's like the difference between, I don't know, like a nice, smooth, flexible hose versus like,
A rusty pipe.
yes, a rusty old pipe. Okay,
Okay.
that makes total sense. And to make matters even more interesting, or I guess complicated, as we age, that stiffening process kind of happens naturally anyway.
Absolutely.
Our blood vessels, they're not as youthful as they once were.
It's wear and tear, you know?
Right. It's like anything else in the body. So we're already starting with this natural stiffening, and then you add potential damage from high blood sugar on top of that.
Exactly.
No wonder the research calls out folks over 80 as having the highest rates of both conditions.
It all adds up. And here's the thing, when you're younger, your blood vessels, they can handle more stress.
They're more resilient.
Right, more adaptable. But as you get older, they're not as equipped to deal with those spikes in pressure.
Like from exercise or even stress, right?
Exactly. So yeah, it's a combination of things. Older adults are more likely to have both conditions, but then the impact of those conditions on their bodies is also more serious.
It's like a double whammy.
Pretty much.
So you really have to be proactive about your health as you age,
Yeah.
especially when it comes to these two conditions.
100%. Knowledge is power. Right.
Absolutely. And it's not just about stiff arteries, right? This isn't just happening in one part of the body in isolation.
Oh, no, not at all.
There's this kind of domino effect that happens when diabetes and high blood pressure team up.
That's true. Yeah.
And the research, it highlights some pretty concerning complications.
Yeah, and these can really impact, your quality of life down the line.
Exactly. We're not just talking about, living longer or shorter, but how well you're living.
Exactly.
And one area that really stood out to me was, well, our eyes. The article mentioned vision problems.
Right, and it makes sense when you think about it, right?
Yeah, break it down for us.
You've got these tiny, super delicate blood vessels in your eyes. And they're delicate for a reason, they have to be. But now imagine all that high blood sugar, increased pressure.
Oh, not good.
It's tough on them. And over time, you start seeing things like glaucoma, retinopathy, and in, the worst case scenario, even vision loss.
It's like if you kept, like, I don't know, shaking a really delicate instrument, eventually something's going to break.
Exactly. And it's not just our eyes, our kidneys are also working overtime.
Those are our filters.
Yes, they're constantly filtering the blood, and high blood pressure, especially from diabetes, it just adds to their workload.
Makes them work harder.
Way harder, and that can lead to, chronic kidney disease, even kidney failure in some cases.
So we've got our eyes, our kidneys, and then the article mentions something that, it kind of hits close to home for everyone, I think. Our brains.
Right, and this is where it gets really interesting, I think.
Yeah, what's the connection there? Because we don't always think about our brain as, like, connected to our blood sugar in the same way.
Well, the emerging research, it's showing us there's this strong link between what we call vascular health.
Okay, so that's the health of our blood vessels.
Exactly. And good vascular health, what does that require? Healthy blood sugar, healthy blood pressure.
So it all ties back together.
It does. Because think about it. Your brain, it needs a constant supply, right? Oxygen, nutrients, and how do those things get there?
Through our blood.
Through your blood vessels. So if those vessels are damaged by high blood sugar, high pressure,
It's like you're creating roadblocks on the brain's supply route.
100%. And we all know what happens when deliveries don't arrive on time.
Things slow down, projects get delayed.
Right. And in the case of our brains, that could mean memory problems, trouble concentrating, even that increased risk of dementia.
Wow, okay. So this is serious stuff.
It is, and it gets even more complex when you look at managing blood pressure in people who already have diabetes.
Because it's not always straightforward, is it?
Not at all. And the article, it specifically brought up systolic hypertension, that top number in your blood pressure reading.
Right. And how that can be really tough to control, even with medication, in folks who have, more severe diabetes.
It really highlights how powerful that connection is. It's not always easy to just fix it, even with medicine.
Right. It's not like one pill solves everything.
No, it's way more interconnected than that.
Okay. Got to be honest. That got kind of heavy there for a minute.
Yeah, it's a lot to take in.
So much to think about. But I always feel like with knowledge comes power.
Yeah,
Right.
totally. The goal isn't to scare anyone. It's to say, hey, this connection exists, but here's what you can do about it.
Exactly. And luckily, there are things we can do.
Excellent.
Like the article had this whole section on lifestyle changes, and it wasn't anything crazy. It was like healthy weight, exercise, ditch the cigarettes.
The classics.
Right. It's like the greatest hits of how to be good to your body. And what I love about that is it's not just about diabetes or blood pressure.
It's everything. It's preventative medicine. It's like investing in your future health.
Exactly. Speaking of investing, the article dove into some specific diets.
Oh, yeah.
And one in particular I'm curious about because the name is great. The DIS diet.
Yes, DAS. It's not as exciting as it sounds, name-wise.
Well, what does it stand for? Fill us in.
Okay, so it's dietary approaches to stop hypertension.
Okay, so we're already talking about blood pressure there.
Exactly. And it's all about, foods that love your heart, love your blood vessels, fruits, veggies, whole grains, lean protein.
So it's like the Mediterranean diet's best friend or something. They get along.
Totally. And it's not about, depriving yourself. It's smart swaps. Less saturated fat, cholesterol, sodium.
Okay, yeah.
Instead of chips, maybe you're having, veggies and hummus.
I get on board with that. All right, so we've got DASH. We talked about exercise before, and we all know exercise is good. But why is it so crucial when it comes to this diabetes blood pressure duo?
It's like this. Exercise, it's insulin's buddy. Helps your muscles use glucose better.
Less of that traffic jam we talked about.
Exactly. And for blood pressure, think of it like this. Your heart's a muscle, right? Exercise makes it stronger. A stronger heart pumps more efficiently.
Less strain, smoother sailing.
That's it. Now, all this said, we've got to acknowledge sometimes lifestyle changes aren't enough. Medication's part of the picture.
For sure, and that's a conversation to have with your doctor, always.
This is informational, not medical advice from us.
Right. But the article did mention some interesting meds, like I'd never heard of SGLT2 inhibitors before.
Oh, yeah, those are cool. They can help manage both blood sugar and blood pressure.
Double duty. See, this is why I love learning about this stuff. Makes you realize how interconnected everything is.
Right. The body's amazing, but also kind of a balancing act.
Totally. So big picture, as we kind of surface from this deep dive, what's the one thing you want listeners to walk away with today?
That knowledge is power, truly. Now that you understand this link between type 2 diabetes and blood pressure, you're already one step ahead in protecting your health. And even if you only have one of these, it's a good nudge to be proactive about the other,
Prevention is always the best medicine. Love it. And for our listeners, if this sparked your curiosity, keep that going. Talk to your doctor, do your research, because knowledge is your greatest health asset. Until next time, everybody, stay curious and take care.